ready? You got me running. Shake it.
I am Meredith Hirsh, joined by Mike Chavez, and this is Working Healthcare. Today, we're diving into a topic that stirs up strong opinions in the medical community: private equity in healthcare.
It's a conversation that gets a little uncomfortable, even taboo. For many physicians, private equity represents a way out of burnout and bureaucracy. For others, it raises red flags around patient care, profit motives, and the loss of clinical autonomy.
Since 2020, investment in healthcare by private equity has surged. In 2024 alone, global healthcare PE deal value hit $115 billion, the second highest year on record. That rebound came after a dip in 2023 and shows no sign of slowing down in 2025. Funds like Hildred Capital just closed over $800 million for healthcare deals, and firms are actively eyeing new opportunities.
And physician practices are at the heart of it. Deal volume has grown nearly sixfold over the last decade. The American Medical Association says almost 80% of doctors who sell to private equity do so to improve contract negotiations, reduce administrative headaches, and gain access to better tech and infrastructure.
Which brings us to today's guest I am super excited about, Dr. Robert Colton. Rob is a physician entrepreneur and one of the early adopters of this model. He co-founded MDVIP, a concierge medicine pioneer that sold to Procter & Gamble in 2009. He went on to launch Clearly Derm, a dermatology group acquired in 2024 by Schweiger Dermatology Group, and just last year, ModMed, a healthcare tech company Rob was closely involved with, received a major investment from Clear Lake Capital.
Rob has been in the room for these deals, building, scaling, and selling healthcare companies. He's seen the promises and the pitfalls up close.
So today, we ask Rob, what does private equity really mean for physicians? Is it selling out or buying into a different kind of future? Rob joins us now to share what he's learned, what surprised him, and what he thinks doctors need to consider before taking that leap.
Whether you're deep in the weeds of private equity or just trying to understand how it's reshaping healthcare, this is a conversation worth hearing.
Dr. Robert Colton, welcome to Working Healthcare.
Well, thank you very much. It was a very detailed introduction, and I would agree that the major reasons that physicians sell out to private equity, the positives are exactly what you brought out there. Better access to capital, better contracting, better access to technologies that they can't afford. And I would add that it allows them to compete with the other big players in healthcare. See, there's been consolidation, and if you look at healthcare, you have the doctors, hospitals, drug companies, and insurance companies. The drug companies, insurance companies, and hospitals have been consolidated in a major way, and they've had leverage over the doctors, and they have the capital to invest to improve their product, but also to position themselves in a stronger way to get a bigger piece of the healthcare dollar. I think what private equity does for physicians, it allows them to consolidate and be on a level playing field with the other big players in healthcare.
And you really bring up a great...
While there's some negatives, there's some positive. There's mostly positives.
So, and I want to start from the very beginning. I want to go back because you are somebody that I've known for a very long time. I met you when my husband and I first moved to Boca Raton, Florida. My husband joined a rheumatology practice. I think we had dinner together at one point. I met your wife, who's a dermatologist, and you and I have fluttered around in similar circles for several years. And you're a Temple member with me. So there you go. Right. So I really want to talk. So I keep bugging you. I'm like, you will be on Working Healthcare, Rob. You will be on it. So I want to go from the beginning. What started your desire to even want to go into medicine and to become a doctor?
You know, it's interesting. I was, you tend to do what you're good at, I guess. And, I grew up in the late 60s and early 70s, is the sort of the hippie era and heal the world and help out the masses. And it's a great time in the history of the United States and youth. But everybody was so,
Peace, love, and
I guess,
happiness.
peace, love, happy, and trying to help the world. There wasn't a whole lot of, um, what we see today in young people, like, I'm going to go out there, I'm going to drive and try to make as much money as possible. And I won't call it greed, but it's sort of greed, whatever. Greed is sometimes good with capitalism. But I think
Rob,
back
we're
then we
Jewish.
had
We're Jewish. You were given three choices:
right,
doctor,
right.
lawyer,
No,
or
no, not at
accountant.
all. Not at
No?
all. My
Okay.
parents, my father, my mother wanted me to be a businessman. My father, so I actually started at Wharton Business School undergrad.
Oh, wow.
But you know what? I was feeling like I wanted to do something that, had a more positive, um, I could put a positive stamp on the world. And I was naive. I will say I was naive, but also really wanted to help. And I really wanted to say at the end of my life, these are all the things I contributed to society. So while I started at business school and I was good at it, I was drawn to trying to do something that was what, at least at the time, what I thought was more beneficial. So maybe I was, you're young and um, again, you're when you're young, you're not as realistic and you're not as jaded, and sarcastic, and as you might be as you get older. So I think, and I was always very, very good at sciences, and I was really excellent. So here it was. I said I can do something. I can help the world. I can use my science skills and probably be very good at it. And as a Jewish kid, you're right. I could earn a living. I mean, I remember telling my dad, I don't really want to go to business school, but I'm really good at science, and I'd like to make a contribution there. And maybe I'll become a physicist. And he said, well, what do physicists do? They become professors. He goes, professor's not a job.
Right.
He said, you flirt with the co-eds or whatever. So I started thinking, so I said, maybe I'll go into medicine. Now, my parents really did not push me. As a Jewish kid, they did not. They said it's a hard job, it's a lot of work, it's a lot of training. You sure you want to do it? Are you tough enough? That kind of thing. They always thought I was kind of soft, that I wasn't tough enough. But I did it anyway, and it worked out wonderfully.
You are
And the other thing
so
is, I met my wife when we were very young in college. She wanted to be a veterinarian, but I talked to her when we decided we would spend the rest of our life together that she would switch and we would become doctors together.
That's super cool. Yeah, dermatology, and my brother's a dermatologist, and so we've talked a
Right.
lot about that. My husband's primary training is internal medicine, but you remind me, not as old as my dad, but you remind me of my dad in that he's very much a businessman, and he actually left medicine when I was 19 years old, and he went the business route, and you sort of went in that direction too, having three very successful companies that you have actually worked on deals with through private equity. But I want to go back to when you were practicing primary care. What was so difficult, or what was so easy, or what even prompted you to want to create MDVIP?
Yeah, well, it's a very interesting story. I mean, I came up to Boca Raton in 1984, and I'm a nephrologist also, but, I did some kidney disease management, dialysis patients and dialysis unit. But my major focus was primary care. And I was in partners with two excellent physicians, Dr. David Herbert and Robert Sonneborn. And we had a really booming practice to where after, a year, it was, people were waiting months to see me. We were very busy. We were very highly regarded in the community, and we were very successful financially. I mean, for the time, we did very well just doing primary care.
And what did insurance look like back then? So when you were doing
Well,
primary care,
private insurance was wonderful. I mean, basically, you billed, the patients paid your bill, they submitted the bills to their insurance company, and they got paid back. And the insurance companies pretty much paid what we charged. And we were able
Wow.
to do ancillary services in our office. We had a laboratory, we had an echocardiogram machine, We owned an imaging center with a bunch of other doctors. So, our income was good. I mean, it wasn't unbelievable, but we earned a nice living together. The practice was booming, and I worked extremely hard, probably, 60 to 80 hours a week. I went to admitted people to the hospital, saw them in the morning, saw them in the afternoon, admitted them at night. I mean, I worked very hard. So things were going very well. And then over the next 10 to, I'd say, 15 years, there was a gradual erosion in our income and our ability to do things in the practice.
What do you attribute that to?
Well, the insurance companies consolidated. They got tougher. They started reducing the reimbursements, denying claims. We had to start, sending our bills directly to them. A lot of times they didn't pay. Over a period of time, they ended up paying us less than Medicare. At the beginning, Medicare was our worst payer. Within 10 years, it was our best payer.
Mm-hmm.
And in South Florida, there was the Stark laws. Listen, I'm not against the Stark laws, which were basically saying that, doctors couldn't refer to an entity that they owned a piece of. So what it did is we had to close our laboratory because we owned it with a bunch of doctors. We had to close our imaging center. So there were other sources of income that we lost. Now there's a loophole in the Stark law where if you have it on site in your office and you own it completely, you can have it. So if you have your own lab, you can do that. If the company owns the lab and nobody else shares in it, the same with an imaging center. So, that's part of the reason why there was consolidation. It was a way to get around the Stark law. But getting back to us, my income continued to drop. I would say it dropped by more than half between 1987, which I guess was my peak, and 1998 or 1999. So in a 10 or 12-year period, every year we earned less money, even though we worked just as hard, due to all these different factors, I guess. And our overhead was going up and our insurance rates were going up and all that. So, there was inflation. So the real value of the money was dropping as well. Now, I was doing okay because my wife was a dermatologist and earning a nice living. So we were able to do okay. But I saw the handwriting on the wall, and we tried various things to try to improve our practice and improve income. So we formed a bigger group. We had a multi-specialty group. We got bought out by somebody because that way you were under one single tax.
What part was bought out?
What?
What part was bought out?
Back in 1999, our whole practice was bought by a company called ProMedco, PROM, and they ultimately went bankrupt. They went under.
Uh-huh. Go ahead, Mike.
Would you have sold had the decline not happened? And
no, definitely not.
Okay, it's so interesting to
sold. We would do better because we would have access to these ancillary incomes, right. and that the private equity company would be able to negotiate better contracts with the insurance companies. None of which happened. I mean, we had the ancillary revenue, but it was minuscule.
It's so interesting
to go up.
So interesting to hear you.
But we wouldn't have done it. I mean, we were doing fine. And then I used to get in fights with my partners because I did most of the business side of it. And they would say, our overhead's too high. We have too many employees. We have a 70% overhead. And I go, it's a revenue problem. It's not an overhead problem. Mm-hmm. We don't have enough revenue. We're charging, we're getting $42 or $60 or $70 an office visit, and there weren't many other sources of income. Now, there were a lot of primary care doctors who managed to do better than we did. Those are the kind of doctors that were seeing 60 or 70 patients a day. And, they would do testing in their office that wasn't necessary, so they would overdo the services. I mean, there were doctors who found a way around it. But if you tried to practice honestly and just do what the patient needed, it was virtually impossible.
Right. So let me ask you, Rob.
The other doctors that actually did well were the ones that went into managed care. The primary care doctors that took risk. That's another discussion.
Right. That's a whole nother animal. But
those doctors did a lot better.
Rob, let me ask you a question. So you sold the first time to this larger entity. Did you buy back the practice at that point when the other one went under?
It was wonderful. They went bankrupt, and we just got the practice back.
Yeah, there you go. So when did you envision MDVIP?
Yeah, it was around 2000, the year 2000. I read about some doctor in Portland, Oregon, who was just charging people a flat fee. I read it in USA Today or something. And he just charged like $800 to the patients and didn't take any insurance, and he was very happy. And I read it, and it kind of, I said, that's not a bad idea. So I remember I took my golden retriever for a walk, and I thought about it for 20 minutes. I said, this is exactly what we need to do. But we'll modify it and make it our own. But we need to do it. And I said, it's such a great idea that I think other doctors are going to want to do it too, but they're going to be afraid. It's hard to do. It's hard to transform from one model to another. So I said, not only am I going to do it, we're going to form a business that assists other doctors in doing it. And I called my partner, Bernie Kamenetsky, presented him the idea, and he said, gee, that's a great idea, Rob.
So describe to me
that's really how it started.
Describe to me what MDVIP was back in 2000.
So what I did is I realized if I was going to do this on a major scale, that I need to bring some business people in who, knew how to create a business and contracts and business agreements, and who could run, that I would be the first doctor to do this, and that they would run the recruitment side and the business side, recruiting new doctors and organizing and getting started up. So I found it took us about a year. We found that one business guy who knew nothing about medicine, and then a physician who would run a couple of private companies. Actually, one who had run a private equity company that didn't work out, but he was pretty smart. So we brought him in, Ed Goldman and Steve Geller. And so what we spent about a year, putting all the documents together, and what we tried. Our biggest challenge at the time was, if you charged an extra fee, did that mean you had to drop off of Medicare? Because the Medicare law says you can't charge more.
Well, you can't charge for a covered service.
So what we did is we came out and realized, and we dealt with a bunch of consultants, and we came out with a model that we would charge for an annual physical examination, a thorough annual physical examination that included your hearing and your vision and an EKG and a whole summary. It was like those executive physicals that existed out there.
Mm-hmm.
That was not a covered service, and we would charge. That was our $1,500 fee, was for the executive physical, and then we would shrink our practice to a manageable size of 600 patients, from 2,000 patients to 600 patients, and that would allow us to be available, accessible, on time, provide more personalized care. And we had comps in the industry that we could show the government that, hey, you can go to Mayo Clinic, you could go to Cleveland Clinic, you could go to this New York, had this private physical company that did executive physical companies. I said, they're charging out of pocket, yet they're still participating in Medicare. So we were real excited. We opened. What happened legally is we got challenged by the government, actually by the state of Florida, that if we're charging a fee up front, that we're an insurance company. We hired a lawyer, we got around that. And then we actually, there was a bill introduced in the Senate that to block what we were doing, but we had lobbyists that got no support. And then ultimately our biggest coup was we had a direct meeting with Tommy Thompson, who was the head of Health and Human Services under Bush. And our lawyer went up there and met him and explained our model. Tommy Thompson said, wait a minute, I have a budget here that's bigger than the GDP of France. Everybody comes to me every day and said, pay for this test, pay for this drug, pay for this. You're not asking me to pay for anything. In fact, just asking the patients to pay. And the patients are going to pay for stuff that sometimes I have to pay for. Because I love the model. It's great. It's wonderful. In fact, he said if I wasn't working with the government, I would join. So sure enough, that was our big win. At that point, he basically blessed our model and said it was legal from his standpoint, didn't violate any federal laws. And after that, our business boomed. But we had to.
So let me ask you though, Rob.
I could say,
so in 2000, why were patients willing to pay that $1,500?
That's a great question. This is a great question. So what I told people was, look, they said when I brought them in at the time, oh, Glenn, my brother's in the back intro. Gotta move.
I know.
Anyway.
I was going to say, I tell my listeners, I've been trying to get you on for forever, and you live down the street from me, and now we're having a Zoom interview because you're in North Carolina. I'm like, Rob, could we have done this when you were in Florida? Now we're like doing this in North Carolina. So you will have to promise me that when you come back for the gorgeous weather in the winter, we will be in person.
Okay.
Deal. So tell me.
All right, Glenn.
Why would patients want to pay
a great question.
the $1,500?
The essence of concierge medicine and MDVIP. Because we had to see a lot of people a day, and because we had our revenue was based on volume, we had to see a large volume of patients, and most private doctors who were fee for service had, a couple thousand patients. So they couldn't really provide the time that patients wanted or needed to provide the most personalized and probably the best care that they deserved. The patients were frustrated. They'd say, Rob, I can't get in to see you for weeks or months. When I call in the morning, and then, you're filled up that day. When I come to see you, you're 45 minutes behind. It's always a hurry. We love you. But let me give you some advice on how to run your practice. That was my favorite. Like, please don't advise me on how to run my practice. So when I presented this model to people, said, listen, you're going to spend, thank you, Glenn. You're going to spend $1,500 a year, and I will be able to do one extensive physical, but more importantly, I'll be available for you all the time. If you call, I'll be able to call you back right away. If you need to be seen, I'm going to see you that day. I will almost always be on time, and I will almost always spend extra time with you. So, of course, when you first presented this model to a public, there was a lot of blowback. Some of my patients were, I don't believe it. I can go to the doctor down the street and not pay you the money. I'd say to them, then go to the doctor down the street. Mm-hmm. But there were a lot of patients at the very beginning who got it. And they said, hey, I spent $1,500 to go on a cruise, blah, 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 blah. This is worth it. I'm going to do it. I'm going to try it. So I had some early adapters that came in, and I was able to, fill up pretty quickly. What happened was these people had such a positive experience with me that they told their friends about how great this was. Mm-hmm. And then all the friends started calling, and the thing just mushroomed and grew everywhere. The same thing happened to all the doctors around the country that we signed up. They were making no money. No money. They were making,
well, they saw their revenue reducing in half
a year, take home pay for working a zillion hours a week. They were seeing too many patients. That all the patients were complaining. So when they set it up, the same thing happened that happened to me. The patients realized that, wow, this is great value. And over time, a lot of people told me this is the best value I ever got for $1,500. And great things happened. First of all, people used to call me on Sunday night and tell me they were sick. Make sure I saw them next day. They stopped calling on Sunday night because they knew they could just call Monday and I'd see them. And the people who were miserable, who I wouldn't pay $5 extra, they left. Yeah. So I got a much better patient panel, of people who really valued my talents and my intelligence and my care enough that they said, I'll pay extra because it's worth it.
So what led to
That's exactly what happened.
What led to the sale of MDVIP to Procter & Gamble? And was it a hard decision or did it feel like a natural step?
Yeah, I mean, what happened was our practice mushroomed. I mean, we started in 2001. We were able to sell doctors all over the country. Our business model was very cash flow positive. In other words, we got the money up front from the patient at the beginning of the year.
Mm-hmm.
So even though we were doing, accrual accounting on a cash basis, we were making money every month. So that was the first thing. The second thing was we did go to we wanted to expand even further. So we raised some money from Summit Capital in Boston. Yep. We raised $6 million just to have a cushion and for them to introduce us into the world of private equity. Then out of nowhere in 2007, I guess it was, we got a call from Procter & Gamble who said, we have a separate division now that are trying to create billion-dollar brands of other businesses. And we looked you up and we thought it was a great idea. Can we send a couple of people down to sit in your office and your corporate office and watch what you're doing? We said, sure. Well, we got nothing to hide, right? So they came in, and then about a year later, they said, we really like what you do. We want to we want to buy a third of your company. So they bought a third of the company. And then after another year or two, they said, we want to buy the rest of the company. And it was a very, generous valuation, based on a multiple of EBITDA. We were doing great. We all said, this was game changing for all of us. And we thought that they would, put more capital in to be able to grow the business. The doctors all over the country, were very happy with what we were doing. So all of us, there were basically, there were 5 major shareholders of the business. And we all agreed, let's do it. Now since the time, I made a nice amount of money. It changed my life from a financial standpoint. I decided about 2 years after we sold that, I'm not going to, I'm going to retire from clinical practice. What happens is I liked what I was doing, but then I got called in the middle of the night, 1 a.m, see somebody in the ER, the family was complaining and this and that. I was exhausted. I'm over 50 years old. I'm thinking, why? I don't need to do this anymore. I like it, but I'll do something else. So that's when I retired from my practice. But from Procter & Gamble's standpoint, they bought it. By the way, they did very well. They sold it back to Summit Capital. They sold it to Summit Capital, who then sold it to Leonard Green, private equity in California. Leonard Green sold it, I guess, last year or the year before to Goldman Sachs. So it's now, we sold it at a $260 million valuation. Goldman Sachs just bought it for over $1 billion. So
it's amazing. It's MDVIP is known throughout the country. So to me, it's
everybody. Yep.
It's so. I mean, I actually, my doctor, my PCP is a member of MDVIP because, as you laid it out, I want to be able to get in when I need to get in. I want to be able to have that concierge level of service, and we see it trickling into the specialty arena. But you made that jump over now to clearly derm, and you completely pivoted. Not completely. Your wife is a dermatologist, but can you walk me through, now you're not practicing medicine on the clinical side, and I remember actually when you started Clearly Derm. Tell me why you decided to do this.
All right, so it's 2011. I walk away from my practice. The story I like to tell is I said, all right, I'm done. I'm going to play golf and relax, right?
No,
so
you aren't.
I went out and I played golf, 3 or 4 times a week. And then it rained, and I was happy it rained. Like, I don't have to play today. So I realized, I said, this is not it. Like, I'm only I'm not even 60 yet. And I still, and I say doctors are smart overachievers, right? You can't become a doctor if you're smart. You have to work hard, learn things, memorize stuff. You have to grind it out, right? So the people are highly motivated, mostly doctors. So I said, we got to do something else. And not business wise. My wife was going to sell her practice, and the company that came in was going to buy it. and I looked at their model, and it was basically we buy it and then we, get some money from the pathology and this. It wasn't anything great. They weren't really creating any kind of care model that was different than the dermatology small office model that was out there. So we started thinking. We said, the access to dermatology is bad. People wait months to see a dermatologist. The hours are terrible, and let's try to. So my wife said, let's do this. Let's try to create a practice that, again, kind of in the MDVIP model, but without the concierge thing, that our doctors would and our providers would be more available, more accessible, and we'd be able to take care of more people, and then we would focus on customer service because, at most doctors' office, they close for lunch. Yeah, who closes for lunch, right? Only doctors, small offices, right? If you call any other business, you call a clothes store, you call a hair salon, whatever, they tell you we're at lunch. But only doctors. We're at lunch from 12 to 2 or something. I mean, all these things we saw when the customer service was bad and every practice closed at 4, whatever. So we decided that what we're going to do is use dermatologists and try to leverage them with nurse practitioners and PAs. A lot of dermatologists were doing that. They had started to do it, but we wanted to, really train our PAs and NPs to be, incredibly excellent and develop their own practices.
Were you doing clinical? Were you guys doing clinical dermatology at the time, or were you doing mostly aesthetics? What was the breakdown?
Almost, I would say it was 80-90% clinical derm.
Okay.
Over time, it's kind of moved more into aesthetics. I would say when we sold, it was more like 30% of the revenue was from aesthetics.
Mm-hmm.
We left it up to the doctors. I mean, in fact, we had one nurse practitioner who loved Botox. She developed a great reputation, Elizabeth, and she does almost all just Botox and fillers now. That's what she likes. One of our dermatologists loves to do, all these laser procedures, and she's doing that mostly. That's what she likes, but does clinical derm. Dr. Weatherall, she likes clinical derm better. That's what she does. We leave it up to the doctors, but our revenue when we sold was about 70-30. So we're more clinical dermatology. The other thing that we did in clearly derm that was a big success is we figured when managed care, if you can't beat them, join them kind of thing.
Mm-hmm.
Managed care represents 50% of Medicare, 50% of Medicare patients.
Yeah, we're now at like 54%.
Are in HMOs. And all these HMO patients want to see dermatologists. It's like everybody else. So what we did is we created a model where we went into the HMO office. We sent in a PA for a half a day or a day to see their patients in their office, and they were supervised by a doctor. And we charged them like a flat rate so that they were able to get great dermatology care. The cost to the HMO was much lower than what they were paying the dermatologist. Patients were happy. They still could go to a dermatologist if they want, but they didn't want to. They stayed with us. So that was one set of our model. And we focused a lot on customer service, answering the phones properly, getting the people in, making sure they were happy, And we did a lot of the dermatology. We did tough stuff too. There's things like these things called biologics. Well, you know all about it from rheumatology. But, you can, some of the more difficult psoriasis and some of the more other inflammatory dermatoses, you have to use some more medication that can have complications and a little harder to use. A lot of dermatologists I don't want to do that. I just want to do skin cancer. So we developed a practice in some of the more complicated illnesses in dermatology as well.
Did you bring infusion in?
We got it developed with Greg. We did do marketing and we brought doctors in. Yeah, go ahead.
Did you bring infusion into the clinics? Were you doing
the infusion in the clinics? That's something we should have done. The thing is, today most biologics are injections rather than IV infusions.
Oh, I would debate you on that one, Rob.
We looked at it. I mean, maybe the acquirer will do it because it's profitable.
Yeah, I just think I'm looking at how your brain thinks, and that's why I find you so intriguing and love to learn from you. When you sold to MDVIP, and then when you ended up selling to when you sold Clearly Derm, how did working for somebody else alter the way that you felt, the way that you work? That's a lot of the feedback that I'm getting from doctors who are considering selling to private equity. They're like, listen, I'm used to being my own boss, and now I have to report to somebody else.
Yeah, I would say this. All of our doctors, all of our employees, they were all employees. Nobody, so we either bought a practice or we brought doctors in from elsewhere. So all of our doctors were working for us. We were their boss. So they weren't independent. They didn't have their own little practice. So that made it easier. But we did run it kind of like a mom and pop. My daughter came in and took over the chief operating officer job, and she was wonderful and solved every kind of problem. And anytime a doctor had a problem, they'd call Becky, and they loved her. So we were very the doctors loved working for us because, again, we were kind of softies. I think since they've sold to Schweiger, they're still working for somebody. There's always, pain a little bit. And when a new group comes over and manages the practice, so they're going through some issues, but everybody's there, everybody's staying. They're trying to work on it. Schweiger does have access to more capital, so they can improve some of our systems. They're on. They have better deals with some of the payers, so they're working on getting better reimbursements. And the other thing is what Schweiger has is we needed more providers in some of our offices. Our rate limiting step in our business was always finding new dermatologists to meet the demand from the public. Well, Schweiger has a lot of doctors up in the Northeast who want to come to Florida. So I think they're going to fill in the gaps. So I think ultimately everybody will probably be fine. They run a top-notch operation. We weren't going to sell to anybody that we thought would just kind of rape the system. I mean, what happened was we weren't actively looking to sell. It's sort of the same story as Procter & Gamble. They called us up and said,
Yeah, you said that
other people we got called, by the way, by all this private equity, but we always turned them down.
Yeah.
And they came and they had a pretty, compelling sale. And we talked to their doctors up in New Jersey. We're very happy with the way it was running. So we felt that it was a good fit for our practice. And so we sold. It was, and it was time. I was already, my wife and I were over 70 and we had a 10-year run. And we said, let's move on.
Right.
And my wife was still practicing a little bit. So she's now, Andy's, they have a clinical trial division and she's an expert at that. So she's still helping them with the clinical trials a little bit.
Yeah.
But ultimately she's going to walk away.
So you said that the physicians were your employees, although you said a couple of times that on the clinical side, what they did was up to them. So hearing it sounds like that was one of the ingredients to the success. So my question is, do you think that since it's been sold, do you think that has changed at all?
Yeah,
and if so, do you think it's hurting the business?
I think they let the doctors practice, the way they want to. But, we always had a lot of practice oversight on the sense that if we didn't like what a doctor was doing, whether it was we didn't like the quality of their work, or we didn't like their billing, that they were, being too aggressive with their billing or whatever, billing for things that we came in while they were working for us and did intervene when we needed to. And we did, let a couple of our PAs and NPs we had a fire. We didn't like the quality of their work. We had to reprimand a couple of our doctors over time. Those types of things happen.
Right.
But in general, we had such a high, maybe I'm biased. We had such a high quality group of providers, mostly doctors, and they all talk, by the way, they all talk to each other. They had the mod med system, which we'll talk about in a minute.
Well, that's what I want to jump to.
If they had a difficult case, one would ask out to the group, how would you manage this? And everybody would opine. And, so it was a real group practice where, everybody felt they were part of this giant team and they knew each other and worked with each other, as opposed to a lot of these acquirers that buy individual practices and they're basically groups without walls. You know that term. groups without walls.
Right.
Yeah.
So they acquire a GI guy and another GI guy, and they're all independent. They don't even know each other. It's a group without walls. The benefit is to get better contracts and get ancillary services. We were a real group that worked, that had the same type of practice philosophy, practiced the same way on all our patients, billed the same way, thought the same way, and talked to each other and presented cases and did continuing education together. So we were different. I think for private dermatologists who had their own little practice and then sell to private equity, I think it's more difficult for them because they were used to doing everything they wanted.
Yeah, and it goes
interference from
and it
anybody.
goes to company culture. I mean, definitely company culture.
We had a company culture.
But I want to understand about ModMed. So modernizing medicine, now we all call it ModMed. How did you get involved with this mega EHR company that is now
funny.
mega?
This was pure, I would say it was mostly luck, but skill because I know where to put my money. So what happened was we were starting this dermatology practice. A friend of mine, do you know Roy Katzen?
I
He's
do.
a neurologist. You do. So Roy calls me and says, these two guys are starting this EMR business for dermatology, and they're raising money. They just started, and we would like you. Maybe you want to invest or talk to them. So I went and I met them, and I immediately felt like they were super capable, knew what they were doing. Dan had run other other practices, and then Michael was the dermatologist, was a Yale, Harvard trained dermatologist superstar. I thought they made a great team. So I kept going back, saying, I think I'll invest. Over a couple of months, I think I drove them crazy. And being that I learned a lot from my business with MDVIP about how these purchasers try to screw you and how to dilute your shares, and there's all this stuff that goes on behind the scenes. So I knew about all the games that some of these companies that raise money did, and I felt after analyzing it, not only that were they developing a great product, they were honest guys who set up the contracts in the right way, and that they weren't going to try to dilute us, and that the language in the contracts were the way it should be. So I liked the way they set it up. I liked their vision, and I thought they were honest and were likely to succeed. Now, most small businesses fail. Okay, let's talk about 90%. Mm-hmm. So I've invested in other businesses, not much, but that didn't work. So I invested more in this than I did in anything else that I invested in. And then, I'm very close with them, and I talked to them. It turned out a friend of mine who's a billionaire from England wanted to invest. He didn't invest in MDVIP. He wanted to invest in Clearly Derm. We said, well, we're not ready, but I'm going to invest in this business. Why don't you come? Maybe you want to. So he ended up investing, took the entire, it was like they were raising in $100,000 units, 50,000. He came in and said, well, how much more do you need? 3 million. He took the whole 3 million and invested more. So his family became board members. I'm very close with him. And, I stayed very involved with the company through this Stephen Rubin and through Michael and Dan. So I didn't really have much to do with it on a day-to-day basis. We brought the system in right away from day one, as each part of every product that they created, we were the first ones to use it. And by the end, we were using it for, our billing, our collection, our communication, our EMR, everything was ModMed in the end.
So early this year, though,
we never
Rob,
had a paper chart. We didn't have one piece of paper.
No pieces of paper. So early this year, ModMed took on a major investment from Clear Lake Capital, and according to the Financial Times, ModMed was valued at $5.3 billion.
Unbelievable, isn't it?
That is so unbelievable, because I do remember it started in Boca Raton, Florida, and I do remember speaking to the C-suite at the several years ago, and I'm looking back at it, I'm like, 5.3 billion, that's phenomenal. So what do you think the goal was behind the move?
Sell?
Yeah, 5.3 billion.
Okay, what happened was they are far more successful than I was in MDVIP or Clearly Derm or whatever. they created an incredible product that basically took over the whole dermatology world, and now multiple other specialties like ophthalmology, ENT, plastics. Then they made all the right moves. In the last few years, they got involved in artificial intelligence. So it's basically being able to use artificial intelligence to help make a diagnosis, help the doctor decide how to treat, how to analyze different practices to see who's doing better, who's treating much, which is the most cost-effective way to treat. They've gone way beyond where anybody thought they would. And the reason they sold, obviously, you would think they sold because, they wanted to cash out. Well, of course, but the deal was all of the investors like me were completely bought out. Dan and Michael, who made a fortune, rolled over a sizable portion of their equity into the new company, and they are going to continue to try to expand it even further into this whole field of AI in medicine, which is booming. I mean, I don't know if you've seen some of these AI stuff. It's pretty incredible.
Oh, it's
in
amazing.
medicine.
Mike is so into that.
Today.
Yeah, Mike is so into that.
It's changed everything and changing everything.
Yeah, it's interesting that that's even going into that, because we have a rheumatology group, and the technology in AI is just unbelievable, and it's changing by the day. So we're trying to do it ourselves as a company, implement those things to help with some of these administrative burdens, and it's like changing the game.
So you're not in the same group.
No. So see, you didn't listen to Mike's podcast. You didn't know. I totally surprised you by bringing him on board, but he's a business guy. He's a connector. We talked all about that on the professionalism Mike and I have known each other for a decade at least.
So which group are you with?
We're called the Leaders Room. We're an MSO in rheumatology.
How many members are you?
So it varies based on the service. So we have, we're all over the country, but some practices just do billing. So we're not necessarily a group that somebody would have to join. They maintain full autonomy. But we do group purchasing, we do billing, we do a number of things.
I'm forwarding you his podcast. You're going to learn all about it, and you're going to love Mike way more. So I want to wrap this up because I do want to do a lightning round with you, because this is fun, because I know that you could run this whole podcast without even me asking questions. So if there's one lesson that stuck with you throughout these 3 ventures, what's the one lesson that you would like to give? What can you bestow upon our audience?
If you're starting a business, make sure you have enough cash. That would be one.
Okay. That's your lesson.
I would say number one is the biggest reason for some good ideas failing is that you're undercapitalized. The second thing is develop a really creative, game-changing new idea.
Mm-hmm.
Bring new ideas to the marketplace. Buying a machine for your office so you can do CAT scans in the office, it doesn't improve the care for the public. Think of things that actually improve the quality of care and that you're providing, and improves customer service. So that's why I think, you have to have a great idea.
Find your
niche. The
niche.
other thing I would say is bring in really smart people that are smarter than you to help you develop your business. I think the other problem that doctors have and people is, they try to do everything on their own. Mm-hmm. Doctors seem to think that because they're so smart, that they can do everything on their own. And when it comes to business, they have no experience. They're not bad businessmen. They're just inexperienced businessmen. And I learned a lot by being a businessman. So realize that you have no business experience. You need to bring business people in to help you.
And don't be afraid to pay them. I'm just jumping on that one.
Don't be afraid of what?
Don't be afraid to pay them, Rob, right? Don't be afraid to pay them. Don't be penny wise and pound foolish.
Failure. I mean, when I started my multi-specialty group, it didn't work. And, so I didn't stop. Say, well, all right, that didn't really work. Selling out, that was a good thing when we did it back in the 1990s. That didn't work. I mean, they went bankrupt. It made us look bad, So don't be afraid of failure. That's another one. And pay, that's right. I think you're exactly right. I think doctors tend to underpay. I mean, we're used to paying a lot of our people answer the phones and a lot of our ancillary, not minimum wage, but fairly low wage. You don't have high earning people as part of most of these medical organizations. But in a lot of ways, you get what you pay for.
Yep.
Yeah.
So are you ready for a lightning round? This is my first ever lightning round. Super psyched
Okay.
for it because you like to talk. So you have only 5 words for each answer. We cool? 5
I'll
or
try.
fewer words. Ready? Let's go. First job ever.
Golf course maintenance,
Coffee or tea?
coffee.
Most used app on your phone?
This is the one I use. It's called Open Evidence. You want to know what that is? But that's what I
No.
use.
I want everyone
Okay.
to look it up.
Look it up. Open Evidence.
So Mike loves this one. The book that changed your perspective.
Book. That's such a great question. I'm forgetting the book. I can't. I'll have to come back.
You
to that.
come back and
Sorry.
let me know because I'm going to post it and everyone's
Yeah,
going
yeah,
to read
yeah.
it. So, biggest lesson from selling your first company?
The biggest lesson is be prepared and review all contracts with an attorney.
Most underrated skill in business?
Most underrated skill in business. Listening.
PE in healthcare, is it necessary or risky?
Necessary.
Are EHRs a friend or a foe?
100% friend.
One thing physicians need to learn in med school that med school doesn't teach?
Always be compassionate.
Proudest career moment? 5 words or less.
Proudest career moment. I would say inventing MDVIP.
And legacy you hope to leave?
I would say that good people. How about this? Quality healthcare products can win.
Okay.
One word that describes healthcare today.
Confusing.
So let me finalize my final question. If you could create one change within our American healthcare system, Dr. Rob Colton, what would that be?
You're not going to like my answer.
It's fine. What is your answer?
Medicare for all.
Okay. I appreciate this. This is so insightful. I learned so much more about you, and I thank you so much for your time.
All right, thank you. I think of that book. I forget the guy's name was named Christensen, and he talked about creative destruction in healthcare, but I can't remember the book's name.
Mike's
You can look it up.
processing because Mike reads all the time. He loves these books.
So
So
look up
you're going to,
Chris Christensen, and he wrote a book about creative destruction. It was so fascinating.
good. So text it to me. I'm
Yeah,
going to
go ahead. I'll
post.
text it to you.
If today's conversation with Dr. Robert Colton sparked your curiosity, stirred up some controversy, or helped shed light on the inner workings of American healthcare, that's exactly the point. Share this episode with friends, family, and colleagues and keep the conversation going. Have questions, feedback, or ideas for future episodes? We'd love to hear them. Visit meredithhirsh.com to connect with us. Working healthcare is all about understanding the nearly $5 trillion American healthcare system, an industry that makes up nearly 20% of our GDP. If you're ready to keep learning about all there is in healthcare, and sometimes things that you don't want to learn, follow Working Healthcare on your favorite podcast platform. New episode drop every Tuesday. Prefer to watch? Full video versions are available on YouTube. And for short clips and behind the scenes moments, follow us on Instagram, Facebook, or YouTube. Here's to curiosity, conversations, and maybe a few answers. I'm Meredith Hirsh.
And I'm Mike Chavez.
Tune in weekly as we explore the inner workings of healthcare.
You ready? You got me running, got me running.